días, good morning. My name is Ana Caballero. I am a PhD student at the Joseph Stefan Institute of Slovenia, and I work as researcher at the Mario Negri Institute for Pharmacological Research in Milano, Italy. Within INTRI project, I am the ESR11, and my main aim is to develop improved read-across models with reference to the endpoints of the project. And we will discuss today about a human aromatase enzyme classification modeling, structural alerts, and chemical categories for read across. Today, I am presenting a part of the job performed during the last 3 years, focusing on different kinds of in silico methodologies as classification modeling, structural alerts, and category formation for read across to explore human aromatase binding of isols compounds. Then the main outlines we are going to follow today, it will be about introduction to the basic concepts about human aromatase enzyme, E-cells, compounds, and read across. The presentation of the methodologies applied to develop the classification model, the structural alerts, and the chemical categories, and then we will discuss about the performance of these methodologies. And finally, I will present some examples of the application of the results for the formation of chemical categories. So let's start now introducing basic concept about human aromatase enzymes, which is an oxidoreductase encoded at CGP19A1 and belongs to the cytochrome P450 family in humans and consists of an hemoprotein and flavoprotein complex. The hormonal balance and aromatization for conversions of androgens to form estrogens during esteroidogenesis are mediated by the enzyme. Aromatase is widely expressed in human tissues, as you can see in the figure, including in adult and fetal brain, placenta, skin, fibroblastos, adipose tissue, and gonads. This enzyme is a membrane-bound protein, which is an integral part of the endoplasmic reticulum and mainly plays an active role in the epithelial cells. The CGP19A1 is mostly present in the peripheral tissues like fat and muscle, and especially in the breast cells and ovarian cells of females. When we talk about aromatase, there are two important points that need to be referred. First one, it is about aromatase inhibitors or chemicals that antagonize the enzymes, which are classified as steroidal and non-steroidal compounds. In the case of non-steroidal compounds, these are subclassified into first, second, and third generation on the basis of specificity and their associated side effects, for example. And then the non-steroidal aromatase inhibitors are mostly isol type compounds used for the treatment of estrogen response breast cancer. For example, the potent inhibitor fadrozole, it is a diazole belonging to the second generation, while anastrozole and letrozole are triazoles belonging to the third generation. These isols inhibitors bind to the enzyme through non-covalent interactions, causing the reversible inhibition and enhanced probability of enzyme recovery after a treatment. On the other hand, the applications of agonist chemicals have been rarely studied. Finally, the chemicals that are non-responsive to human aromatase, then that means they are inactive on the enzyme, are also desired for chemical applications such as environmental safety and human health, because some of these substances are used as plant protection products and may be present as contaminant, and at this point chemicals leading to endocrine disruption, that is what we are looking to the right, are not desired, but this is a topic probably for another day. Then, as I mentioned before, the second important component in our presentation are isols. Isols are a class of 5-member aromatic heterocycle compounds containing one nitrogen atom atom and at least one other non-carbon atom, such as a nitrogen, sulfur, or oxygen, within the cycle ring. On the basis of the number of nitrogens atoms present in the aromatic ring, azoles are classified as monosols, diazoles, triazoles, and so on. And that is what we are observing. To understand better how these concepts are linked, aromatase, isol, let's to refer to some document studies reported about human aromatase and isols. The structure-based virtual screening for drug design, such as the Dokian studies, have been employed to identify the binding mode of the drug molecules with the target protein, which can unlock the uncomponents such as hydrogen bonding, aromatic sigma-sigma interaction, electrostatic interactions, and to name a few more, contributing to non-covalent interactions. Another concept that we will be addressing, it is about read-across. Read-across, it is the process of assessing a toxic endpoint of an untested substance based on the results for the same endpoint for a tested substance considered to be similar in the context of structure, properties, and or activities. Grace, in an article published in the year 2017, suggested 7 steps that could address a global workflow of read-across: decision context, data gap analysis, overarching similarity, rationality, analog identification, analog evaluation, data gap filling, and uncertainty assessment. But this is not a rigid road, and although the great efforts of the scientific community and the great progress made in this area, there is still a long way to go. Recently, the read-across assessment framework RAF, developed by ECA, provided a framework and guidance for consistent evaluation of the scientific aspect of a proposed read-across case, resulting in an output which is suitable for subsequent regulatory considerations of the read-across case. Then, after to talk about the read-across workflow, what could be, let's to mention something about a strategy for the analog identification step, which will be the one where we will be focusing today. It is important to highlight that within the REACH regulation, read-across is founded on the principle of structural similarity combined with a scientific justification, while within the OSD guidance, the basis for assessing similarity is typically elaborated with the possibility of other considerations to assess analogous similarity. In any case, it is important to take or to reference the words from Cronin, where he mentioned and said that whilst molecular structural similarity, it is a highly pragmatic approach to identify potential source analogs, it is not on its own sufficient to justify a read-across, and indeed may be not considered as a basic element. For this study, experimental values have been retrieved from a high-throughput screening assay of TOX21 program, and they selected the same measures aromatase inhibition activity on aromatase breast cancer cell line. Entering now on the second outline proposed, I'm going to present a resume of the methodologies employed in this study. Let's start with the classification modeling. To build the classification model, the SARPy software was used. SARPy is a knowledge extractor tool to obtain relevant substructures and generate new knowledge, analyzing a dataset of binary activity classes. A substructure filter was applied to identify the compounds containing the extracted fragments and their distribution within the classes, using a decade node of 9. As is shown in the graphic, for the ESOL's dataset, The ESOL's dataset was split into monosols, diazoles, and triazole training sets. And relevant chemical fragments were extracted from each subset. Then these were grouped into a single list of fragments that posteriorly were cleaned to eliminate duplicates and meaningless fragments. Then, considering the accuracy of each fragment within the training sets, a reliability level was assigned to each one, and finally the full dataset was rescreened. The performance measures parameters for each structural alert, the accuracy, and the L-error that can be visualized in the equation 1 and 2 were calculated through predictions made by fragments using the NIME platform and SARPile software. In the case where more than one structural alert was identified within a structure, the prediction was based on the structural alert with the highest L-error value. It is important to highlight that based on initial reliability levels assigned to each structural alert and through a protocol implemented to retrieve most suitable fragments, the full list of fragments was reduced to the most relevant ones. The other equations that are presented also were used to explore the performance of the model. Now, the second strategy that needs to be explained refers to the methodologies to identify analogs for read-across. For this, an automatic workflow is executed using NIME platform, and the procedure implemented offers two main applications. First, the identification of analogs, of course for read-across, and the assistance during analog evaluation, when the target chemicals are considered as SMILE notations. The expected output is a list of candidates to analogs. Individual lists of aspirants are retrieved from the dataset considering different kinds of similarity methodologies. This could include, but not necessary, structural, physical, chemical, metabolic similarities, structural alerts in common with the target. Then the chemicals in the source database are ranked for each similarity, and then a list of each one, including the top ranked compound, is returned as a first output. A second output is also given including only intersection between all similarities. The number of analogs retrieved by each list, included also the final list, can be of course customized during the analysis. To evaluate structural similarity, two main aspects are addressed: the chemical structural codification and the similarity metric. In this study, POCAN fingerprints and Tanimoto index are considered respectively. POCAN fingerprints are binary substructure fingerprints that can be used for chemical codification and similarity searching, where a substructure is a fragment of a chemical structure and a fingerprint is an ordered list of binary bits, 1 and 0. Each bit represents a Boolean determination of or test for the presence of a certain structural property, for example, an element count, type of ring system, atom pairing, and others. In the case of the similarity measure, we use the Tanimoto coefficient, as I already mentioned, which is identified for several studies as one of the best similarity metrics for fragment-based similarity searching. And it's intended as the similarity measure between 2 points A and B with key dimensions. The equation illustrates its mathematical definition, and it is the equation 7. The Tanimoto similarity is only applicable to binary variables, and the coefficient range are from 0 to 1, where 1 of course represents the highest structural similarity. In the case of physical-chemical similarity, the consideration physicochemical properties to evaluate similarity, it is a process less elucidated respect to the previous discussed one. Relevant and interpretable properties respect to the final endpoint need to be established. Therefore, the selection of physicochemical properties is endpoint dependent and cannot be generalized. Then in our workflow, we propose to consider the log P topological polar surface area and the molecular weight, which contribute with important information about pharmacokinetic considerations. The similarity measure used was the Euclidean distance. The application of the Euclidean distance for data fusion have demonstrated a good performance. The Euclidean distance, it is the ordinary straight line distance between 2 points, in our case chemicals, in the Euclidean space. Consequently, chemicals are located within a coordinate system, specifying each point uniquely by a set of numerical coordinates, in our case physicochemical properties, as is defined in the equation 8. Finally, in this strategy, the last two components are the structural alerts and metabolism. First, structural alerts are classes of chemicals, functional groups, or substances that are linked to a particular endpoint that support the identification of substructures related to toxicity in very early stage of research. Structural alerts can be used to evaluate chemical similarity, since certain groups of fragments experimentally have demonstrated to be associated with a specific toxic effect. Hence, robust structural alerts linked with an associated mechanistic basis are applicable as a screening tool to recognize potential mechanistic similarities. In this study, structural alerts were elucidated after a rigorous process of consistency assessment of the final list of fragments included during the classification modeling development. And in the other hand, what we have, it is the process associated to metabolism, and for this we use Radliber S9 metabolism simulator, which is a software that covers reaction rules of approximately 70% of phase 1 and phase 2 of metabolism derived from metabolic reactions reported in the metabolite database to occur in humans. Our third outline intended to discuss about the performance of the methodologies here employed. Following our previously discussions, let's start with the classification modeling. As we can observe from the graphic, when the fragments extracted were employed to predict the chemicals within each training subset, the statistics were quite promising, and we obtained higher values of accuracy, sensitivity, and lower values of unpredicted rate and error rate. And that was what we were expecting. Then the full list of 41 fragments obtained from the different classes of the azoles, 18 monoazoles, diazoles, triazoles, was applied to all datasets to evaluate their performance when applied to the full data, which can be another method for cross-validation or fragments of fragments to display the quality of the fragments. Based on the previous analysis and a protocol slightly implemented, a total of 21 fragments were extracted from the pool. The model of 21 fragments was again evaluated through the statistical parameters that were before specified, and as it can be observed, the sensitivity, specificity, accuracy, and accuracy of the model were 93, 84, and 96% respectively, which describe the goodness of the model for predictions. It must be noted that the model had the unpredicted rate as 29% due to the fact that the 21 fragments were matched in 230 chemicals structure out of the 326 chemicals. In any case, the error rate was kept low. As in the previous case of the model classification, the analog identification workflow was also evaluated and validated. Then we was mainly exploring four methodologies. This included first a methodology that recognized analogs based only on structural similarity. Second one that was included structural plus physicochemical similarities. The third methodology was including structural, physicochemical similarities and common structural errors with the target, and the methodology 4 that included all the previous components plus common metabolites with the target. As you can see, the performance between methodology 1 and 2 were quite similar, and this is of course due the fact that physicochemical properties were calculated on the basis of structural properties or structural descriptors. An improvement of statistics and performance is observed when other factors as structural alerts or metabolism are included in the analysis. But let's go to discuss or to analyze better some exercise or examples about how these methodologies can be applied and how all the components that we have observed until now can be integrated within an exercise. In this example 1, we will predict aromatase binding of 2-aminobenzodiazole, which will be the target chemical. The target endpoint will be preliminary defined, and the category will be defined based on analog having a common metabolite produced after in vitro liver metabolism. We will apply the methodology 4 to this exercise. What we are observing in the blue square here are the chemical identifiers of the target, and below the physicochemical and molecular properties calculated for it. In the green square appear the scaffold of the structural error identified in the target chemical and the predicted metabolites for it. In the center of the figure appear our target chemical, and around it the chemicals that were found to be in the top of a structural and physicochemical list. All these chemicals present a common structural alert with the target, which was associated to agonize the enzyme. In plus, the two chemicals within the blue oval have a common metabolite with the target after metabolism predictions. In the table to the right, we can observe the values of the parameters calculated for these two chemicals that will be used to make a prediction, and also the values of the similarity measures employed, Tanimoto index and Euclidean distance, considering that these two chemicals were labeled as active agonists within our database. The prediction for the activity of the target therefore will be agonist. What is right? Let's go now to study a second example. In this exercise, we will build up a mechanistic category based on a common structural. The category obtained using this structural alert consists in an alkyl imidazolium derivatives, which exhibit the ionic liquid's properties. The ionic nature provides the unique characteristics to these organic chemicals, such as green non-aqueous solvents, biocatalysis, and the commercial applications such as photovoltaics. The properties of such organic ionic liquids chemicals depend upon alkyl chain length and the counter-anion present with the organic cation. As you can see, the full category is about antagonizing the enzyme. From our study, we was able to reach conclusions about this category that are written in the green square. We conclude that the inhibition activity of the alkyl imidazole cation was observed to increase, that means decrease inhibition concentration, with increase in alkyl chain length. However, there may be some breakpoints in the curve where the activity change with alkyl length became steady. These were associated to the anion effect. In the blue squares appear other studies or some of the studies that also have been reported a common mechanism of action for ionic liquids. For example, the first one say that the toxic effect to the human health of ionic liquids have been defined through the cell membrane disintegration, followed by increased production of reactive oxygen species and DNA damage. Another study made out on the lactatic dehydrogenase LDH has demonstrated the LDH inhibition activity of ionic liquids, which was found to be increasing with the increasing in the alkyl chain length of ionic liquid cation. Also, the inhibition of the lipase enzyme activity was found to be dependent on the chemical nature of the anions, and inhibition activity was found to increase with increase in the alkyl chain length. And to conclude our talk today, only to say that we was giving a short introduction about the state of the art of human aromatase enzyme, isols, compounds, redox, and also an automated workflow that implements good practice for toxicological data gut filling, giving emphasis on the combined use of different similarities to identify analogs was addressed to date, and finally examples addressing the possible applications of diverse in silico approaches as fragment-based modeling for classification modeling, structural layers, and read-across were discussed. And I can conclude this presentation with to acknowledge all the people that made this possible. I want to acknowledge the Institute di Ricerche Farmacologiche Mario Negri in Milano, Italy, and also the Joseph Stefan International Postgraduate School of Ljubljana, Slovenia. I want to say thanks to the Entry project and especially to the Mary Slowska Curie Action Innovative Training Network. I want to say thanks to my three PIs, especially to Emilio Benfenati from Mario Negri Institute, who has been my tutor during the last 3 years, directly working with me. And also to Mariana Novik from the National Institute of Chemistry, who has been my support and tutor at the university, and the Professor Mark Cronin, who was a really polite person when I was doing my secondment at Liverpool and helped me to make this possible. Also, I want to say thanks to external partners of the project, especially to L'Oreal, where I was able to make a secondment and it was a great time, and other external collaborators, especially to Dr. Domenico Gadaleta from the Mario Negri Institute, and my darling colleague, the Dr. Shaiwan, that make all this possible. Thanks to everybody, thanks in three.